My first guests are a breast cancer survivor and the medical oncologist who provided a very remarkable treatment, and we're going to discuss that right now, just to how impressive and awesome it was. First off, we have Bonnie Lockhart, the breast cancer survivor, and we have Dr. Mohammed Harb, the medical oncologist. Both of you, thank you so much for making the trip up here to join us. Bonnie in particular, because I know she's not from here. You drove, I don't know, 10 minutes maybe. But
probably, yeah. Thank you for inviting us.
Thank you.
Absolutely.
Yes.
Absolutely. So, Bonnie, we'll get your story first.
Okay.
Because I know that, of course, through the entire process of going through breast cancer, certainly it's can be devastating, obviously. I guess to start, Bonnie, let's discuss when you found out, what was going through your mind.
Okay. Well, when I found out, I was alone because I had had what they call a core biopsy, and it came back negative.
Mm-hmm.
Obviously, they missed the tumor. So when I went to see my doctor in Amherst, the blood work and everything had come back from him having removed the tumor,
Mm-hmm.
and it showed that it was indeed cancer. And I had this awful thrill of fear go through me.
Mm-hmm.
And I went out to the car afterwards and called my husband. And I had intended to go shopping. We were joking earlier how much I like to shop, but I went straight home.
Mm-hmm.
And that was my first knowledge of having cancer.
Mm-hmm.
But I would like to say that I had received the card from the breast cancer place to go and have a mammogram,
Mm-hmm.
and I let it sit on my bulletin board from October until March.
Mm-hmm.
And every couple of weeks I'd say, I must go have that done. I must go have that done. And I advise everybody never to let that happen.
Mm-hmm.
So I had it done, and that was the result.
Mm-hmm. So very thankful, of course, that you got that done.
Indeed.
You know, early detection is certainly huge in that
Yes,
situation.
it is.
You mentioned the mammogram. What was your next step when you found out? What was your game plan? Did you have any? Was it just kind of?
Well, I must say that when the core biopsy came back negative,
Mm-hmm.
my family doctor said you can wait 6 months for another mammogram, or you can have the tumor removed.
Mm-hmm.
And he recommended I have the tumor removed.
Mm-hmm.
He said, you don't want that in your body. And so my doctor in Amherst, Dr. Nader, removed it. And that's when later I found out. And so then after that, that's when Dr. Harb took over.
Mm-hmm.
And I just think he's wonderful. He's a wonderful oncologist. He really is. He's kind, thorough. Always says, is there anything else I can do for you that you want to know or whatever?
Mm-hmm.
So then he took over with chemotherapy, and then I had radiation therapy at the George Dumont Hospital. And then after that, I had the Herceptin, which is what we're here to talk about.
Mm-hmm. Yes, absolutely. The Herceptin SC.
Yes,
and I made sure to
Herceptin
write that
SC.
down because that
Yes.
is very important.
Yes.
And we'll get to that in just a second. But Dr. Harb, I want to get your viewpoint on this first. When Bonnie came to you in this whole situation, what happened next?
Yeah, I mean, so just to talk about just a little bit about breast cancer. Breast
Mm-hmm.
cancer, it is one of the most common cancer for Canadian women,
Mm-hmm.
right? And probably in 2017, we probably had around 26,000 women diagnosed with breast cancer patient.
Mm-hmm.
And as Barney just mentioned, she had Herceptin. Not every breast cancer patient do have the ability to have Herceptin, because only just 20% of all breast cancer patients produce or overexpress the HER2 receptor, what is the Herceptin, it does work.
Mm-hmm.
So usually what happens, so after the patient had the surgery, they come to us through the surgeon, they send us a referral.
Mm-hmm.
And we sit with the patient, and I think so. You was lucky at that time in one point, because at that time I had a clinical trial where was a phase 3 clinical trial where we were trying to compare giving Herceptin IV versus Herceptin subcute. The SC, it means under the skin, treatment goes under the skin. So I'm sure for the first visit for Bonnie was really very difficult to accept the fact. First of all, she had a breast cancer, and secondly, she has to go through chemotherapy and the Herceptin. And you know, oncology is one of the specialties quite unique, and we have to spend really plenty of time. You cannot rush it to discuss these things with the patient, because patient and the family, they are sensitive, right? And they are looking for help. And I think so in our cancer center, in Moncton City Cancer Center, we have really an excellent team. It's not just only the oncologists, we have the nurses, whereas they sit with the patient as well, and we discuss the whole process of the treatment. And the first meeting with the oncologist is always the most upsetting for the patient, and we try to make it as easy as we could.
You did. I could add here as well that every person I came in contact with at the hospital, the nurses, the volunteers, and the doctors, without exception, I would give them an A+. They were wonderful. And I've heard other people say that. Yes.
Major kudos to them for sure.
Absolutely.
And all the support
Yes.
staff, because we always think, you know, doctors and oncologists and specifics to that, but it's all the support staff as well that go into
Exactly.
it as well.
Exactly.
Yes, it's true.
Yeah.
Yes.
No, for sure. So let's talk a little bit more about the Herceptin SC treatment.
Yeah.
And certainly in comparison, at least from what I understand, the normal IV treatment is around 90 minutes.
Yeah.
And then this Herceptin AC, it's just a few minutes.
2 to
Yeah.
3 minutes.
Yeah.
So let's just explain a little bit about what does mean breast cancer patient overexpressing HER2, all right? So the HER2 is a protein where these 20% of breast cancer patients producing or overexpressing this protein. And this protein is, you found it on the surface of the cancer. And the Herceptin was founded to target this receptor, all right, because this receptor gives a signaling to the cancer to grow. And the goal for this Herceptin to target this receptor and to block the function of this Herceptin. And with that, with blocking the function of the HER2 receptor, you destroying the cancer as well. In Bonnie's case, I mean, we do believe she was clear from cancer, but some patient with HER2 positive, not the majority of patients with HER2 positive, it is more aggressive than other type of cancer, all right? And we always try to attack if there is any residual disease left behind, which we cannot see at this point with any CT scan or images. And this treatment, the way how it came to our practice, there was hundreds of clinical trials has done in the past comparing those patients who had, for example, chemotherapy, Herceptin, or those patients who has no treatment. And the risk of the cancer to come back, it was much higher on those group of patients who had no treatment, comparing with those patients who had chemotherapy and Herceptin. And so Herceptin has been in our practice for years now, and we know Herceptin is really very good drug for patients to prevent them from having cancer to come back down in the road for 5 years or 10 years.
Right.
But we use it for metastatic patients as well. Metastatic mean when the cancer has spread. But in Bonnie's case, the Herceptin was, the goal for giving her the Herceptin was to avoid her from having cancer for hopefully forever, all right? And as you know, cancer patient, breast cancer women, they don't want to spend most of the time in cancer center.
Of course,
Right?
they want to live their life.
They
of
would
course.
like to spend time with the family, with friends, all right? And this is the whole idea for comparing these two products. I mean, they are the same product, but in these two ways how to give it, all right?
Right.
So, sorry, yeah.
Yeah, I would love to continue to explore this. Unfortunately, we don't have time. We have to
Sure.
go for a break. But Herceptin SC, is there any place just very quickly they can get more information?
Yes, exactly. So you can reach to us. We're more than happy to go to give any information about the Herceptin subcutaneous, which is given under the skin. You can
Certainly check it out.
Yeah.
And thank you so much for both of you for coming on here.